What happens to health practitioners that don't participate in practice transformation initiatives? They get left behind and don't help shape the future of healthcare. Don't be left behind. Get on the bus. There are many stops that the practice transformation bus will make. Medical Home, the Comprehensive Primary Care Initiative, Accountable Care Organizations, State Innovation Models, and Million Hearts are just a few of them. These initiatives are helping providers cut costs, increase efficiency, improve fragmented care, and enhance the quality of patient care nationwide. These initiatives are happening concurrently, and a provider can be involved in multiple initiatives at the same time. All of these initiatives are shifting from provider-focused to patient-focused care, which will require new care management skills, including using data to manage patients and enhanced transitions of care. Of course, electronic healthcare record systems and their ability to exchange information are critical elements for all of these initiatives. Now, if you are like most providers, you probably have some concerns. You may be wondering how you can realistically make these changes with limited staff and resources. Or maybe you're thinking about your time and how you will have less of it. Fortunately, the regional extension centers are available to help you. REC staff members have the skills needed to assist with practice transformation because of their prior and current support of implementing electronic health records. Some REC service offerings that can help in practice transformation include practice workflow redesign, clinical quality measurement and reporting, security risk assessments, and guidance on health information exchange and patient and family engagement. Let's look at each practice transformation initiative, starting with Medical Home, a model of care where patients, and oftentimes their families, have a direct relationship with their personal physician. This can include enhanced access to the physician via a patient portal or email. The physician engages the patient in shared decision-making, which takes into account the patient's goals and preferences. The physician coordinates a team of healthcare professionals that uses the whole person approach and arranges for appropriate care with other qualified providers when needed. The practice is proactive regarding population health management, such as running registries and identifying at-risk patients. There are a number of elements of meaningful use that support medical homes, including patient education, transitions of care, clinical quality measure reporting, and privacy and security requirements. RECs can help your practice become a medical home by educating you and your staff on implementing the medical home, assessing your practice's readiness, providing guidance on how to overcome implementation barriers, and providing tools so you can track your practice's progress. Becoming a medical home can lead to enhanced quality of care, increased career satisfaction, and lower healthcare costs. Medical homes not only empower patients to make health decisions that may lead to better outcomes, but also encourages patients to view their physician as their advocate, strengthening physician-patient relationships, as well as relationships with other practice team members. The Comprehensive Primary Care Initiative is a joint effort between Medicare and commercial and state health insurance plans to improve primary care. They offer bonus payments to primary care doctors who better coordinate care for their patients. Currently, there are 497 primary care practices serving an estimated 315,000 Medicare patients involved in the CPC initiative. Many of the CPC milestones are related to meaningful use requirements. Therefore, RECs are well positioned to provide tools and guidance to achieve these milestones. For example, CPC Milestone 3 is 24/7 access by patients. RECs can help your practice with remote access options, including establishing patient portals and new workflows to support these options. Now, you may be wondering how the CPC initiative would impact your practice. Well, you could gain access to new resources from multiple payers, including CMS, get to know your patients a little better with all of the data provided by each payer, such as the cost of care and the types of services and resources utilized, while also sharing in the savings from CMS and other payers. Let's move on to ACOs, or groups of doctors, hospitals, and other healthcare providers, who come together voluntarily to give coordinated, high-quality care to an assigned population of patients. There are federally funded ACOs, including those offered by Medicare and Medicaid, as well as private ACOs. If ACOs improve care and quality measures and reduce cost in a certain time frame, they are able to share in the savings with Medicare, Medicaid, or a commercial payer. ACOs are focused on moving away from the fee-for-service model and towards pay-for-outcomes model. RECs can help providers understand ACOs. The medical home is the foundation of the ACO model. Meaningful use criteria, such as transition of care, patient portals, quality measurement, and managing a population of patients, are all key elements. The goal is based on effectively managing a population of patients under a pay-for-outcomes model. Care management is an important element, so ensuring that a practice can leverage their electronic health record system in support of this is critical. Joining an ACO can help your practice achieve greater efficiency in delivering quality care, obtain access to important health information technology shared among ACO members, and enhance patient satisfaction. The collaborative nature of ACOs can help lessen the burden of health IT for smaller practices and widen the patient pool for all entities involved. The State Innovation Models Initiative focuses on improving health system performance by integrating public health policy and multi-payer payment reform. CMS has provided funds to each state in the program so they can create and test new state-based multi-payer payment models. 16 states are developing their models, 3 states are further refining their models, and 6 states are testing their models. The models are broad-based and focused on people enrolled in Medicare, Medicaid, and the Children's Health Insurance Program. The Million Hearts Initiative brings together communities, health systems, nonprofit organizations, federal agencies, and private sector partners to focus on preventing 1 million heart attacks and strokes by 2017. It focuses on improving the ABCs of patients: aspirin when appropriate, blood pressure control, cholesterol management, and smoking cessation. RECs can help providers improve health outcomes by leveraging health information technology to take targeted and impactful action on the ABCs. Joining the Million Hearts Initiative is making a commitment to help save lives. Because the ABCs targeted for improvement by Million Hearts align with the meaningful use objectives, practices can work toward achieving success in both initiatives at the same time. Don't be left behind. Get on the Practice Transformation bus by exploring the Practice Transformation page on the healthit.gov website, where you will find more information about these initiatives.